100 years ago, cities and towns in the United States were dealing with high rates of illnesses and deaths from the 1918 influenza pandemic. I will describe how the town of Framingham's townspeople and public health professionals dealt with the emergency created by the pandemic. We learned many lessons and important public health strategies from their experiences. Framingham had one of the lowest death rates in the country from the pandemic. At the time, Framingham was the site of the landmark project called the Framingham Community Health and Tuberculosis Demonstration. Tuberculosis was the leading cause of disability and death. It was the first community-based project to demonstrate that it was possible to reduce tuberculosis disease by 55% and tuberculosis deaths by 68%. The demonstration developed the public health model for community-based disease investigation and control that we still use today. It includes disease case finding, reporting, and treating, contact tracing and testing, isolating infectious cases, close monitoring of contacts to infectious cases, and a robust health education program to inform the townspeople how to protect themselves from diseases. Like today's coronavirus pandemic, the 1918 influenza pandemic created a major public health emergency. Hospitals were overwhelmed. There was a shortage of hospital beds and the need for a field hospital. There were shortages of doctors and nurses, as many had been drafted into the war or were sick themselves with the influenza. Routine health visits and clinics were suspended. All public gathering places like schools, churches, theaters, dance halls, bars, and bowling alleys were forced to close. 3,000 sailors, who are often housed in close quarters in barracks, were moved to a military camp at Musterfield in Framingham to be separated and protected from the severe influenza outbreak in Boston. The townspeople joined in the struggle by donating bedding to the hospitals and using the kitchens at the high school and college to prepare food for the hospitals, the sick, and the poor. Many teachers volunteered to help the nurses in the hospital. The townspeople were well informed, since the public health professionals gave them frequent, clear, consistent messages on how to protect themselves from infection and what to do if they became sick. Those who were sick were monitored and instructed to remain home. Townspeople were instructed to go outside into the fresh air and walk, rather than use crowded trains and trolleys. Frequent health letters were posted in the local newspapers. Like Framingham, many cities and towns across the United States had the lowest death rates in the country from the 1918 influenza pandemic because they followed the advice of the public health professionals. The highest death rates from the influenza pandemic occurred in cities and towns that ignored public health warnings. This has been brought to you by the Public Health Museum. It was created by Kathleen Herson on July 6, 2020. For more information, please visit the pandemic site of the Public Health Museum at www.publichealthmuseum.org.